7 minutes. We're 7 minutes early today. We've been early the last 2 times.
Yeah.
We're killing it. Just quietly. We're killing it. So to start off, as everybody's just logging on and getting your little notifications, we are both recovering from COVID. So if we're low energy or our brains completely zone out, it's because we had COVID. But we do have a list of things that we thought we'd start talking about, like as people are logging on. You want to pick one and start, Dom?
Oh, gosh.
What about if a person rocks back and forth for hours, would it mean anything? Because yes, it does. It does mean something.
Absolutely.
If you notice a person rocking back or forth, hi, thank you so much for joining. Welcome.
So what we're so much more aware, when we're dealing with neurodivergence, people know a lot about the sensory sensitivities where people, are overwhelmed by a particular sensory experience, but it goes the other way as well.
Yeah.
So there's certain sensory soothing things that people, particularly with autism, much more, really, really help them. And sometimes that's the only thing that's going to help them.
Yep.
Rocking that's both vestibular and proprioceptive. Which
explain those two terms.
Yeah.
What does vestibular mean, Dom?
So I'll just kind of go, senses. We've got the 5 senses, sight,
taste, touch,
all the ones
smell.
we know about. We also have vestibular.
Hi, everybody joining.
Which is dizziness. That's our inner ear telling us where we are in space. That's the one that makes you car sick. That's the one that makes you sick on rides. But it's also the one that makes
mine's a pain.
Roller coasters and things like that really
awful.
Fun.
The second you said fun, I said awful.
For some kids, spinning a lot of kids spinning will actually be a really soothing experience. Proprioception is where knowing where our joints are, where our body is, and so that rocking is moving your whole body. It's got the rhythmical aspect to it as well.
I enjoy it very much.
So for the rhythm side of things is also a big part of the
Hi everyone, thank you so much for joining in. As always, same rules. Drop any questions that you have for a psychiatrist in the comments. No personal medical advice, but you can ask anything you want at all.
So generally, if somebody's using...
Ask any questions, go for it.
Yes, we've got a question coming up. So
Angie,
if
hi,
anyone's
love
using sensory
you.
soothing, then they're trying to soothe their nervous system, and if they're doing that, it means their nervous system is dysregulated in some
I do
way.
a lot of rocking. I love it.
Oh, yeah.
Hi, Angie.
The chair at school.
Yeah, I love a good rock.
Yeah.
I find it very, very calming.
We had rocking chairs in the past for a reason.
I know. Bring them back.
I have a spinny hand chair at home. It actually looks like a hand, and you sit in this part of it. It's
I hate them.
armchair.
I hate
it
them.
Spins, though.
I know, and I hate
You
them.
can sit in it and spin.
Oh, let's do narcissism. We've spoken a lot about it. So we'll answer Princessa first because she got in first. Why do narcissistic people crave so much sex? Lots of thoughts on that.
Oh, yes.
Self-validation, ego. Dr. Dom, what are you thinking?
The sensory. It
24,
takes them,
I'll write you down next.
out of their heads. But when we're talking about sex, there's so many different aspects to it.
Say sex.
Oh,
They'll
sex.
cut you.
Sorry.
They'll cut you.
Okay, I'm just working out what I can say and can't say.
Can't say nothing.
Because we're talking about the emotional aspects, we're talking about the physical pleasure sides of it, we're talking about power, though, as well. So,
the power dynamic.
And narcissists are unfortunately going to find that an area where they can really
control someone.
Absolutely.
Now, can you get to 20? As someone who struggles knowing what emotions are and how emotions feel, a window of tolerance chart's good to use.
Absolutely.
Heck yes.
They are the
Use
bomb.
that window of tolerance. Dan, we can talk about emotional blunting next.
So just for people who don't know what window of tolerance is, it's this incredible concept Dan Siegel developed a long time ago. Now we just use it with pretty well any area, or whether it's anxiety, whether it's trauma.
Bipolar bunny, I'll get to that.
And it brings in two things. It's bringing your capacity to differentiate different levels of emotions, and it's helping you really develop that self-compassion, get to know yourself. So window of tolerance, it's where we've got at the bottom, we've got avoidance, which means not having, in this case, not having any emotions. And then at the top, above the top line, we've got overwhelm, which is where those emotions have gotten so overwhelming you can't process them, you can't work with them anymore. Then within window of tolerance, we've got uncomfortable because you're doing something new or something that you don't feel that practiced at. And it might be just a little bit uncomfortable, or it might be getting very close to overwhelm uncomfortable. But anywhere within that window of tolerance, your brain is learning. Your brain's,
Akathesha, I know that you're struggling right now, and so we're not going to take that on. But I really do wish the best for you.
Yes.
And hope that you can come to a much, much better place. It's a B24.
Oh, hypoarousal and hyperarousal. Yes. So we're just talking about window of tolerance, and just, a lot of the things we work with, different language, different ways of talking about it. So if we've got hypoarousal, that's where your body's gone into that much more shut down, less activated state.
I always think,
is
that's so
at the top
cute.
of
Thank
that.
you, guys.
Very same, it's that sitting within the uncomfortable, but not to the point that it starts to become harmful to your nervous system, and really developing those skills about being able to be kind and compassionate to yourself, and knowing when do I actually need to not expose, or when is it safe
and
for
learn
me to do
how
it.
to say no. It's more always in hypoarousal state.
Okay. And so, that's where...
Can narcissistic people ever heal?
Yeah.
Yeah, they can. Yeah.
So people will vary a lot. Some people are sitting constantly in the hyperarousal. Some people will go back and forth between, just go straight from hypo to hyper. One of the reasons people can be sitting in the avoidance or hypoarousal, that's the not doing state, is that your system can feel, I'll just go straight into hyperarousal. And what we work with is anybody who's, working with window of tolerance, is it's really trying to find those little steps that you can step into, where you can just start, because the more you can come out of avoidance, the more you can build that window of tolerance. But it's all about gentle, it's all about listening to yourself.
Isabella, thank you for asking, but we intentionally don't use personal details on here for obvious reasons. Miss Leah, my son is always in fight mode even after a simple request.
Okay.
Kids can be that way.
And also let's talk about PDA.
Yes.
And just to be clear, we're not making a diagnosis,
no.
Obviously not just on a single question, but I think it's...
Do you want to say what PDA is first?
Absolutely. Part of what we're trying to do here is decrease stigma, increase understanding about different concepts.
It's a B, I'll write that down as well.
And pathological demand avoidance, or PDA, is just, we're just starting to really understand it, and gosh, it makes a big difference once people understand what they're working with, because you need a totally different approach. So what basically happens in pathological demand avoidance, it is not just the child being difficult or the adult, and it's where they're experiencing that threat to their autonomy.
Shushi, I'm writing you down. Dan, I haven't forgotten about your blunted emotions questions either.
It's where the response to the demand sets off such a strong kind of survival mode fear related to autonomy that it actually overrides all the rest. It'll override need to eat. It will override the need for safety, physical safety. And once we understand that's what's going on inside, a poor little person's brain, then it's very much working with ways to help them maintain that autonomy, but still get what they want to get done. What's
now,
next?
Can we go back to Dan's question?
Yes.
He's still in here. He said he feels emotionally blunted.
Yes.
It's been a year. I can't feel emotions and pleasure. To me, that we don't give any personal medical advice, but if I hear people saying I'm not feeling any emotions, I'm not feeling any pleasure, that's reading as depression.
That can be a very common cause for it. It can also be the thing that takes a lot of time to recover, even when somebody's been treated for depression. So their mood, their sadness and the depressed side of things might lift, but accessing pleasure and emotions can be a lot more difficult. We have, part of it's interoception, which is that capacity. We feel emotions in our body. It's a felt bodily sense. And if there's a disconnect preventing you accessing that information, it'll prevent you feeling emotions.
Guys, if I'm ever looking down, it's because I'm writing your questions down so nobody here.
The good news is we are so much more understanding, first of all, how important it is to access those emotions and how to turn them back on again when they've been turned off. There's a lot of psychological strategies in this area now.
So can we go to another question then from Shashi? ADHD, could that be a reason, undiagnosed ADHD, why I have trouble understanding my emotions?
Yes, absolutely. Look, we're having an epidemic at the moment. The level of, we use the word emotional intelligence. It's a skill, emotional skills, where there's been generational kind of effects on people actually really developing those strong emotional skills. But with ADHD, to be able to actually do your emotional processing, you need to become aware that you have the felt sensation. You need to be able to sit with it long enough to work out what it is and make sense of why it's there. If you've got ADHD and your mind's constantly being pulled about by other things, it's really, really hard to just sit and emotions are slow as well. I really struggle with this one because my mind can make sense of it before my emotions had a chance to catch up. And
Shashi, if you have a son that has ADHD, always a good idea to go and get yourself evaluated because there is a strong genetic link.
We are so much,
That's why I got diagnosed.
A lot of presentations, member in the family, and then the rest of the family starts having a look.
Yeah, it's really validating, Lydia. It's really, really validating. So nobody here wrote depression on and off. Should I get an ADHD assessment if they've had depression on and off for years? If there is something inside you that's saying, I want to get an ADHD assessment, go do it.
Yeah.
But lots of GPs in many states in Australia now can do it. I think we're saying Queensland, Victoria, WA. If you are able to, I would say go and do that. Junior's been talking about chronic anxiety. Meds not really helping. Psychologists have tried, but no avail. I could talk about anxiety all day long. I've had panic attacks. I've been diagnosed with generalized anxiety disorder. I no longer have panic attacks. I have a lot of coping strategies. I do a lot of icing. I do a lot of breath work. I do a lot of grounding. So just talking about
what icing is?
Icing is physically getting ice from your freezer and putting it wherever it feels good. I ice my face. I ice my neck. I ice my wrists. It's just like a little snapback.
What Hannah's doing there is she's giving a really strong sensory information straight back into her vagus nerve, which then goes up to the brainstem and says we are safe. Anxiety is it's there to protect us. The problem is when it starts firing all the time. There's two ways to be thinking about anxiety too. Sometimes we work very much with what's the thoughts or background fears that are driving the anxiety. So that's much more that cognitive thinking side of things. But for some people, it's working much more from like Hannah, working much more just with the autonomic nervous system. We understand the biology of anxiety, disordered anxiety now.
For me,
so
it's
much
all
better.
about
For a lot of people, it's actually better to go physical.
Yeah, for me, physical's the only thing that works. I have to physically distract myself. Trauma cannot cause ADHD. ADHD is brain wiring. You're born with it or not, but it can be misdiagnosed with other things that can look like ADHD. Do you want to comment or unlock these genetic makeup sort of questions, Dom?
Yes. So,
because there's a lot in there.
One of the things with, the real interest in attention and ADHD at the moment is...
And we'll talk about addiction next.
That, the core symptom of ADHD is attentional difficulties.
Roxy,
and
okay.
It is not the only reason why people can have attentional difficulties. So, yes, trauma will absolutely cause difficulties with attention because your system doesn't want you to concentrate on anything. It wants you to be constantly scanning for danger. And when we're talking about ADHD, we're talking about a very specific condition that has a neurodevelopmental background to it.
It's how your brain's wired.
That's the way how your brain's wired. But there are a lot, attention is affected in nearly every different mental health condition. So that's a good reason why, we're saying people really need good assessments. If the issue is attention, it's not always ADHD.
Dom, can we donate 60 seconds to addiction? There's been a couple addictions questions coming through. Then we'll do Roxy, and then we'll do Madism.
Yeah, we were talking about this just before we came on.
We were talking about anxiety just before we came on.
Because, we've got both addiction, and then nowadays it's very much talked about as substance use disorder, but then we've got the other areas of behaviours like gambling, which very much falls into that addictive behaviours. And addiction has got, for some people, especially if there's a biological genetic history, if it's run in the family, there is a strong biological basis to that, and there are ways that we can support that biologically to help people recover.
Thank you so much. Hey, Foxy.
Core of any of these things, shift the shame at the beginning, because it just, if you're trying to get treatment or change a behaviour up against underlying shame, your brain just will not shift.
I've dealt with addiction and substance use disorder, and I'm happy to talk about it. I'm not ashamed of it. I'm doing great now. I'm not totally sober. I still have a glass of champagne.
And that's the real difference. For
or a glass
some
of wine
people,
if I want to.
If they've got that very strong biology, they're going to need the complete abstinence, stay right away from whatever it was addicted to. And others, there's a lot more flexibility there. At gambling, gambling is a particularly difficult one. It's got such a strong dopamine hit associated with it, and it is actually
that doesn't appeal to me at all. I've gambled a couple times, and as soon as I win $1, I take the money out because I'm like, I beat you.
That's exactly my mode as well.
So gambling I don't get, but I am aware that it is hugely primed to trigger pleasure senses in your brain.
There's a lot of social issues about gambling and gambling addiction as well.
And gambling ads is just disgusting.
Look, I've definitely had people report back that they're trying to be in recovery and they're getting ads specifically targeted towards them.
That's disgraceful.
And that is...
Can we do... we're going back a little bit and then we'll try and catch up with everyone. Roxy, memories popping up when feeling guilt. GPs can prescribe stimulants in certain states. Yes.
Yeah, so... one of the ways we talk now in trying to understand our inner kind of world and what we're experiencing, one of the ways I find really helpful is to think about, the parts of us.
Oh,
and,
I'm so sorry.
What you can kind of work with is if you've got a memory coming up, when you have a particular emotion in the present, there's a part of you that's kind of bringing up something for attention, for awareness, whether it's trying to, prevent you feeling guilty in the future. There's lots of different reasons that can happen, but it really comes at being interested and curious. Okay, these memories pop up whenever I have this particular emotion. Are they very much, and then approaching those memories in a very compassionate, interested way in, one of the things when we're talking about mindfulness, mindfulness is the ability to be able to kind of within your own inner world is to step back and have an observer of your own experiences.
Christine Dominique has experienced medication-induced akathisia, so she knows how horrific it is.
It is one of the most uncomfortable experiences I have ever had in my life.
Madison, addiction to both substance and gambling. We'll talk a little more about addiction, I think. We'll get a bit deeper into that.
It's a very serious, very uncomfortable side effect. and it can be really hard because it's an inner sense of restlessness. So it's got no thoughts associated with it. It's got no kind of understandable external reason behind it, and it can be very hard to explain. But anyone who's working with medications that can have that as a side effect are going to be looking out for it as well, hopefully.
I mean, hopefully at this point in time, it's a different phase. We know a lot more about
Absolutely.
it. But yeah, awful, horrific.
The drugs, I got it to anti-nausea medication, and nowadays we rarely use those particular ones, but they're still around a little bit.
Now, we're still seeing a lot about the gambling, and can psychiatrists identify their own mental illnesses? That's an interesting question because insight is a complex thing.
Yeah, absolutely.
And I think there's a bit of yes and a bit of no in there.
But it's also one of the ones that we have to be very aware of is, in most areas now, I know here in Australia, we have very strict requirements about peer supervision and peer review, which is where we go and spend time in meetings with other colleagues, and that's and they're very safe spaces, very supportive spaces, and
it's a B. We'll get to that.
We've got a lot of resources now for doctors, any doctors, including psychiatrists, to be able to access very confidential, very supportive, so that they can get in early and have a check of, if there's anything going on that they need to be aware of.
So we will get back to gambling and discuss that more, but I firstly wanted to say with Harmony, BPD diagnosed ADHD, CPTSD, trauma, bad anxiety, and some medications made me not myself. That is the nature of them. Unfortunately, some medications can leave you feeling flat.
Yeah.
It's different. It's really hard to find a good balance. Talk to your doctor, talk to your prescribing doctor, tell them all of your symptoms. You've got a lot of cross-diagnoses happening, a lot of comorbidities happening.
And there are diagnoses that often connect together as well.
Hey, Aspie, I'm an Audi. Welcome. Can we talk about It's a Bee's comment? I sometimes feel like flashbacks are my body feeling guilty for what happened to me. I think that would make a lot of sense for a way for you to rationalize, but you don't have any guilt for what happened to you. You are not in control of this. You're not responsible for this. You should have no shame for this.
One of the first things we work with when somebody comes in with a trauma history, and particularly when they're getting a lot of experiences in the present, even when that trauma was a long time ago, is just to really shift any thoughts that they were responsible or
you weren't.
Absolutely.
You're not broken.
No.
And I like to say
most trauma symptoms are a really understandable response to the trauma that occurred. If anybody experiences, major trauma,
thank you so much for all of your support, everyone.
All sorts of things occur in the longer term, like flashbacks, and we really try to reduce that stigma, reduce that shame, and very much shift any sense of the guilt belonging to the person who experienced the trauma.
Please don't be afraid of psych wards. They are not like Girl Interrupted. If you go to a psych ward, in all general instances, you'll be treated with a lot of kindness and a lot of compassion and a lot of people who really do want to help you. They are in this industry because they care deeply about their patients and about people's mental health. So I just wanted to scroll back a little bit to say to It's a B24, you are not broken, and also human beings are not made of glass. One little knock isn't going to break you. Doesn't matter what it was, you can always come back from it. You're defined by yourself and not by what was done to you. You're also not alone.
No.
So many people have experienced what has happened to you. There will be people in these comments that read this, that understand it, that feel it, that know it, and you deserve all the love and support in the world and zero shame. Move that shame to the person who's done that thing. Do you want to go to Harmony, who's talking about I get bad? Thank you so much, guys. Your support means the world. If you can like and share and boost the post, it really, really helps us. Harmony, I get bad hallucinations and it's getting worse. I'm going through court and nightmares that feel real. Court is one of the most stressful things that happen to people. Dom, I'll let you talk about that.
Look, it's one that it's
yes, Christine, go for a
challenging
diagnosis.
Part of our system at the moment, where traumatised people are put into a very sterile, structured, legalistic system. And it is very difficult while court proceedings are going on for much healing to occur. But it's very much about being aware of how that court process is affecting you.
It's one of the most stressful things that people go through.
Stressful.
It's very, very hard to be in active litigation.
And the court process, they're not. They
Nick Tablin have written you down,
but they're looking for information. They're they've got different agenda to to the health side of things. And it is very, very common for trauma-related symptoms to get worse during that process. And there are often people within the court to help support.
Yes, there are.
And the courts are far more open to supporting people with PTSD and way, way much more understanding of the impact that PTSD has on memories. I was so impressed. There was a major court case a few years ago where the judge actually in his deliberations said part of why he believed the witness was because they couldn't give a coherent history because of the nature of the trauma. So people get very worried, look, I'm not going to be able to tell this coherent story without breaking down or having flashbacks. It's part of what you're presenting as evidence. So
Harmony, I just got a Crown prosecutor and I just wanted to end it. I don't know how long it is. Yeah, court is hard. Yeah. It's really, really hard.
Best of luck with it, and I really hope you get...
Wishing you all the best. Yeah. Thinking of you. It's brutal. Brand Mind might have missed it, but I've got a few comments from SC. ADHD versus PCOS. Thank you so much for the support, guys. We really are.
So PCOS, polycystic ovary syndrome.
Yeah, very different.
Yes, but it is connected from the perspective of we are just really becoming aware of the impact of female hormones and the cycles related to female hormones on mental health in general, but particularly ADHD. You do get fluctuations both in the actual brain function and in the effectiveness of medication through your cycle. PCOS is going to be more challenging from the perspective of you're not necessarily going to have that regular cycle.
Harmony, you've got
but this. But they can definitely be connected.
Can we look at, we've had this comment from several people, signs of ADHD in adults?
Yes. So it always comes back to those core attentional issues, but in adults...
Leah, I've got you next.
You're often going to see a lot more masking where people have adapted or are, so if we talk about executive functioning, which is a big part of what you will see with ADHD, that's getting the basic daily tasks done or getting through life admin and all of those things.
Rebecca, I've got you down.
There's a lot of... so what we're often going to see in adults is they might be out functioning very well in the workplace, but then coming home absolutely burnt out and exhausted and not keeping up with things at home.
Brand Mind, I'm sorry, we haven't seen your comment, so I don't know. Can we jump to Leah's question? How do I deal with my husband with BPD?
Yes.
Personality disorders are tricky ones. They're often also, BPD is often also misdiagnosed. Dom, what do you say for people who are living with partners with BPD?
Look, it makes a big difference if you know they've got a diagnosis, and
absolutely.
Then it's a matter of, are they taking responsibility for their diagnosis, and are they looking to get the supports and things?
Unknown,
We've got
I'm sorry. Rebecca, you're next.
Yeah, we've got really good the dialectical behavioural therapy is very effective. It's skill-based. It's actually really helping people develop those skills in their both interpersonal relationships and in their emotional regulation. And if they are working with a therapist with any of those, any of the different kind of approaches that we use now, being able to have a look at what language and what their therapist is suggesting they do, so that you can feel comfortable reinforcing that.
Do you want to jump to Leah?
Okay.
Oh, sorry, no, Rebecca. Rebecca is saying that she's having dangerous, intrusive thoughts. So intrusive thoughts, we've spoken about these a lot. These are things that, like, I don't think this, but I've looked at my incinerator and thought, what if I put my hand in there? I'm not going to put my hand in my incinerator, but I've thought it. Dom, intrusive thoughts.
Yeah, look, so they're
Chris, you're here. Thank goodness.
They're a very
Missed
common
you.
experience, and they can be very distressing. Sometimes they have a real push to them to follow those thoughts. Sometimes they actually feel the exact opposite of kind of like, I wouldn't think of doing that. So it can be very different.
Thank you so much, Chris. God, we love you.
In the past, it was very much kind of how do we remove them, how do we push them out of our minds. We've realised that anytime you get into a battle within your own brain or your mind with whether
if I'm off screen, guys, I'm writing your questions down, trying to get to them.
Intrusive thoughts. It's not going to work. It's actually just going to make them worse. So what we talk about now is very much stepping back, trying to come from that observer position. And Rebecca, yes, they are they are not a reflection of the person at all. If anything, often it's quite the opposite, where those intrusive thoughts will contain violent thoughts that would never be, we call them ego dystonic when that's happening, when they're so distressing
sexual
to the person.
Thoughts. Sorry, I'm not supposed to say that word.
They can be that, they can be violent thoughts. But that does also help you identify them. Shifting it across, it's my brain. Okay, my brain's got a circuit here that's creating these thoughts. Shifting out of the content and across into, that's exactly what's happening when those obsessional intrusive thoughts are coming. It's very specific. Obsessional intrusive thoughts are coming. It's very specific thoughts. Shifting out of the up, but best, it's a really, really distressing experience when your brain's
disconnected us for a second. Okay, Brand Mind, I can see you've been here for a while. My teacher in class 8 gave me foot spanking in front of my mate. I still have the issue. That is abuse. It
was a very specific, very real major trauma.
Yeah.
And, one of the things about trauma is we tend to have a very particular idea of what...
Void list, I've got you written down.
And I'm so, so sorry that happened to me, because that is absolutely...
And Christine, I've got you written down.
There's a couple of things that will really add to trauma. If it's something where a person who was in a position of power, or, a teacher's in a caregiver role, and when they abuse that power or act in the exact opposite way they are, that's got a whole trauma associated with itself. If that happened in a classroom, we've got the humiliation side of it in front of it.
There's just so much going on.
There is so much there. Any time a person's got ongoing experiences of trauma, they're real. If you are still having experiences of it, months, years down the track, then it's trauma related. It's stuck in your system and in your brain, and we have a lot of really effective treatments to work with that.
Thank you so much for everyone joining and supporting. You guys, we're here for you, and your support is absolutely the world for us. Also, please go follow Chris. He's our moderator.
Thank you always to Chris.
Chris is like, awesome. He is running everything behind the scenes.
Allows us to really focus on the questions and giving us much.
Can we look at Christine's question from a little while back? So she's an ADHD boyfriend who often assumes that her comments are insults. I don't think that's related to his ADHD, personally, my opinion. I'm not the doctor, so I can say whatever I want. Dr. Dom is bound by codes of ethics. I'm not. I'm just an angry older sister.
Look, it's also that, when we're talking about neurodivergence, it is at the moment we don't have brain scans.
We love you, Chris.
Or
please follow Chris.
Particular kind of ways of dividing it out. And people who've had a diagnosis of ADHD might also have some of the traits that we see in autism. People with autism might have some of there's a whole crossover there. It might be helpful to know that for people with autism, not everyone has, the reading facial expressions and reading people's emotional intent. It's one of the ones that gets a bit stereotyped. Oh, autistic people can't do that. That's not true.
No, I'm very good at it, actually.
Some people can actually be really good at it.
Yeah.
But there is actually a grain of truth in it that there are a certain subsection of people with autism who really do struggle with facial expressions, and they will read most facial expressions as angry.
Do you struggle with facial expressions?
Me personally, no, but I have I have close contact with somebody who does, and they will read them angry. So it makes sense. So if you're not sure what you're reading, your system's going to respond to, well, what's the most dangerous here, or what's the one that and Hannah, Hannah. Is it
Hannah Gadsby?
She's an incredible stand-up comedian who's very open about having autism, and she actually talks about it in one of her comedy specials. Is the moment where she realised that that she was actually doing that, and she literally had that. Isn't it just normal? Aren't all faces always angry? So yes,
that's so funny, Kate. I'm the opposite. So faces I'm good with. Body language I get confused with. I don't have prosopagnosia, which is facial blindness, but if everyone's dressed the same, I can't tell you apart. So I can't watch any war movies because they're all dressed the same. I have no idea what's going on.
And look, part of what, when we're working with NeuroKind, we're wanting to kind of really change the understanding of neurodivergence. And one of the biggest things is that the differences in different people who are under the neurodivergent umbrella but can just have such different experiences. A lot of the things with autism can either be hypo, decreased, or hyper.
So I
often
think
not in the middle.
The whole autistic people don't like making eye contact. Very true for some autistic people, not true for me. I'll look you dead in the eye until you break it. And my son's the same. My son, he loves eye contact. He gets right up in your face. He'll stare at you until you're uncomfortable. Rebecca, I'm seeing you're leaving a lot of comments making me feel that you're in a lot of distress. So I just want to say, please be kind to yourself. Please be gentle with yourself. Please book an appointment with your GP because GPs are amazing. Find, my advice, find a woman GP. Why am I going to put my dollars into the pocket of a man? That's crazy. In this economic system, in this global financial world, no. Find a woman that you trust, a GP you like, and really go through it all without any shame.
In a lot of the big clinics now, there's going to be one or two GPs who are really specialising and subspecialising into where mental health has been a real interest for them. Mm-hmm. They set up their clinic so that they've got the increased time and really act as a wonderful bridge for people, because they've got an easier accessibility and they kind of sit between a regular GP and a psychiatrist or a psychologist.
My GP is the greatest. I see her every 3 weeks. Every 3 weeks
really
now.
Regular,
for 2 years. Yeah. She's my therapist. I also have a psychiatrist because hello.
Don't do that. Don't do
I know Dominique's like, don't do
that.
I'm a little loopy. Okay, unknown. I did see hey Lisa. Lisa's I'm out of lorazepam. Good evening. Good morning to you. So how can they give any advice if they haven't had the experience of what I'm going through? Lots of people won't have the experience, but they have a lot of training, and it takes time to develop a good relationship, safe relationship, trusting relationship with your physician.
Yeah.
So
you never know what a person's experience is either.
That's the other thing. And your doctor might not tell you. They might have experienced the same thing.
Because, from a boundaries perspective, it's generally not appropriate. Not
we'll
because
talk
there's
about
any
that.
stigma or anything associated with it, but it's about your time. But the other thing is, anyone who's worked in the area of mental health a lot, we've had a lot of time to get to understand the human experience. One of the biggest things that's shifted for me, I've been 20 years in this area now, and, my capacity to bring an interested, curious approach to anybody's, because I've now heard so many different experiences that people can, and you'd be amazed how common some of the experiences, Lisa, can be.
We're in the future and it's hot here. You need a little bit more makeup. You need to mind your own manners. Now send 5,000 likes, be a good boy and jog on your way. Now, L, what's the difference between borderline personality organization and borderline personality disorder? I'm not familiar with borderline personality organization.
I can talk to this. So it's just a different word for trait.
Oh.
So one of the things at the moment, people are throwing around the personality disorders a lot, from the point of view of both narcissistic and borderline personality disorder. The diagnosis of a personality disorder actually requires a pretty high ceiling of effect on function across multiple different areas of life.
I love you, Chris.
What we do see far more commonly is people who have traits, is what we call. So in certain circumstances, or it might be that they are more likely to respond to things with some of the borderline type behaviours. So it's kind of like a lesser level, I guess, and it's a helpful way of, we all have traits.
Can we do H's question, because she came up first, but then we'll do Lisa's.
Yeah.
Been to doctors about my no energy. Physically, I'm fine. Have mental diagnoses. Nothing helps. And then we'll do Lisa's, which is OCPD.
Yeah.
Obsessive compulsive personality disorder.
Okay, so the area of that really heavy fatigue and lack of energy has really opened up since the virus. Am I allowed to use the COVID term nowadays? Is that
I'm not sure. We'll just say the virus.
Because, there was
Voidless,
a
I'm writing you down.
fatigue syndrome that became very apparent with so many people affected, and it's really, really opened up all of the study and understanding of our energy metabolism at a metabolic level, but it's still a very, very early area in our in the science side of things, and in mental health, it's then that real challenge of trying to differentiate out where might it be more from that energy, physical kind of side of things. Where is
Madison, your mother-in-law sounds like a. Keep going. Sorry, Dom.
Yeah, where is it an effect of the mental health issue, particularly in trauma, the shutdown states. So
F that be, Madison.
The parasympathetic freeze state will really prevent people being able to access energy. So there's a lot of different aspects to it. Okay, did we have another?
Yeah, we had Voidless had a question. AU ADHD dislikes meds options. So I'm AU ADHD. I take Pristique for anxiety, but I don't take any medication for ADHD.
Yeah, so this is very real. People with autism do often not have the same responses to medication. And again, this is a very much a generalisation. When we're talking about neurodivergence and autism, very different responses with different people. But there is a big group who don't have the same responses that you'd expect to medication. And we definitely in AU ADHD see quite different responses for a lot of people.
Yeah, Lisa,
to the stimulant medication that's really effective in pure ADHD. It's important for whoever's prescribing medication to know when a person is autistic because of those differences. There's a thing called interoception, which is your awareness of your internal sensations. That can affect how much you can tolerate medication as well, if you get really aware of the side effects or the differences when you're taking it.
Now, I'm out of lorazepam's, Lisa, and so her question was, can you please explain obsessive compulsive personality disorder?
Yes, this one's a really interesting one because you just don't hear it talked about.
So sorry about that unknown.
And it's one of those ones that got put into personality disorders, but there's that real question mark about is that a helpful way to refer to it? It's and there's a real probability that it will come across to neurodivergence as a new. So at the moment we've got the big ADHD circle and it overlaps with the big AU autism circle. We're looking at adding in a fair few more circles, and one of those will potentially be the obsessive personality. It's a way that your brain is wired, it's a real asset in some areas.
It's great in some parts of my work.
Absolutely. You do not want a doctor who doesn't have a tad of the obsessionality. You definitely don't want a pharmacist or somebody building a bridge who doesn't have a tad of that obsessionality. It's about any of the things that are related to the way your brain is wired. The more that you can understand and see it as both the areas where it helps in your life and the areas where it does make things a little bit more difficult, and really approach it from that acceptance, and then how do you have to modify it to get things functional?
Gina,
I hope that's answered the question.
Yeah. And always, Lisa, add in anything else that you're curious about. Gina, I was diagnosed with schizophrenia in 2016. I can't tolerate the meds.
Oh, gosh.
I'm assuming lithium. Is lithium still the first line?
No, lithium's first line for bipolar.
For bipolar,
disorder,
right.
So it's a mood stabilizer. Look, this is a really tricky
thinking
area. There's been so much work gone into trying to get medications that are both effective and tolerable as well. And oh gosh, I'm just losing my voice. I'm
We've
sorry.
Both had COVID, guys. We've both had COVID. But we're here for you.
The big thing I would be saying to anyone who's struggling with their meds is really make sure you're talking to whoever's prescribing them and letting them know what's going on, because there's a lot of tweaking we can do when we're aware of difficulties with it. And it is because the medications for schizophrenia, they're long-term, they're every day. You're wanting to get them optimised to get them as tolerable as possible. Sometimes what we do too is if we have to use a medication that does have really difficult side effects, there's sometimes medications that we can use to manage the side effects. We don't like doing that particular...
The stacking is annoying, but sometimes...
We don't like having to do that, but if that's the only way that we're going to get a person both treated and comfortable, then that's what,
I mean, I had to have so much stacking during my pregnancy.
Oh, of course, yeah.
But it's a bloody nightmare.
Yeah.
How can I get a proper diagnosis? This is from Emmy. They always put it back on my trauma. We have spoken about the fact...
Is Emmy female? Almost certainly, yes. I'm assuming.
Emmy, yes, is female.
Because one of the big areas, I'm assuming you're talking about a diagnosis for...
CPTSD, trauma. Well, she's saying they always put it back on my trauma.
Okay, but I'm assuming that you're talking about a diagnosis of neurodivergence, probably ADHD.
Well, it'll be the ones that cross over the ADHD, the ADHD.
We are so much more aware now of the crossover. So there's actually very good science that shows
Emmy, if 3 out of 4 of your siblings have been diagnosed with autism and ADHD, I got a surprise for you.
It's very much when we see that family history.
It's genetic.
It can be very tricky.
Twin.
With ADHD, unfortunately, because we're using stimulant medication, there's laws around their use, and there's a lot more need for a diagnosis that fits very specific criteria. So that can make it really tricky because it does require information prior to 12 that really clearly shows the ADHD.
See if you can get school reports saying she never shut up, she was always yapping, she was never focused.
But it's one of the things we're looking at when we're working with anyone who comes in with attentional difficulties is looking at that crossover, but they can definitely coexist as well.
So
Just the other thing to say on that one is sometimes if we're not able to give a diagnosis, but there's a strong sense that attention, there's really big issues with attention, is there a non-stimulant medication that don't require as stringent a diagnosis? So that's sometimes the way we get
Lisa, is there pharmacogenic tests in Australian healthcare?
Yes, there are. So they're through, they used to be just through the pharmacy that you, a quite specific company that would do them. They're about $200, and which is quite a big investment, but it's an investment for life. So, and nowadays, most of the major pathology companies are doing them as well.
Grace.
They take about 4 to 6 weeks to get back. So if you're going to get them done, there is a bit of a delay.
Grace, how can I tell if I have ADHD?
Oh gosh, there's so many different aspects to it.
So many different things. For me, procrastination, trouble with task initiation, trouble with completing tasks, jumping all over the place. No worries, Chris, you do what you got to do. School reports show I stopped attending grade 4. I'd have complete weeks absent, school refusal. Yeah, that to me sounds, and remember that I'm not a doctor.
Okay,
I'm a lawyer.
I'm going to pop in here because school refusal, I'm not a child psychiatrist, so it's not something I work with a lot, but it can have two big things behind it. It can very much have an anxiety aspect to it as a big part of where that one comes in. And it can also come about with untreated PDA, pathological demand avoidance. But there's multiple different reasons why school refusal can occur. So it's really then about digging back about what was going on at that time that led to it and contributed to it.
Rebecca, again, we see you. What is the most relaxing medicine in Sydney? I'm on the edge climbing walls on Valium, ATM, not work. I'm going to talk to you like a big sister. I need you today to log on, to find a local GP clinic, look for the friendliest female face, and book an appointment with her.
Long appointment,
not a short appointment.
When you ring up, they'll say, you say it's a mental health, the receptionist hear it all the time. They know then to book you enough time that you can really get heard.
Grace, you have nothing to be afraid of. I'm AU ADHD, and knowing that has made my life a whole lot better.
Yes.
I feel so much less shame for things that I felt so much shame for. I understand myself so much better. It's helped my life a lot. You have nothing to be afraid of.
It's why we're here and why we're working with this is because, there still is a bit of that kind of stigma and do I want to know about this? It just makes so much difference to your core sense of self and your capacity to accept things about yourself.
Above BPD versus BPD, are they different or just a worsened mental state? I'm confused. Was this the traits versus the diagnostic? Was this BPD traits versus borderline personality disorder?
Maybe, I'm not sure. But what I will jump into is why is Valium so hard to be prescribed? Valium's a benzodiazepine. It's a very specific
Not sure
class.
if you're allowed to say these words.
Am I allowed to say
I think you can probably say benzodiazepine. Okay. I'm not sure.
Yeah. It's a class of drugs that are very effective in short-term management of anxiety, but they're not as effective in long-term use, and they actually have some really serious side effects. And if people are taking those medications long-term, they can actually get quite cognitive issues, and they don't know that they're getting them, so it's a really big issue. It affects memory and capacity to think clearly. But it's also that there is a very real risk for a certain proportion of people who start those medications to get very addicted to them. And, whenever we're working with medications that have got that addictive potential, we have a responsibility to be very thoughtful about the prescribing and not actually kind of have somebody get worse with them.
So Kez what does getting a diagnosis do? For me, it helped me drop a lot of shame.
Yeah.
It helped me understand myself better. It helped me regulate. It helped me go, oh, that's why I struggle with that. Like, I'm not flawed. I don't need to be ashamed of this. It made me understand myself better.
It really helps then, because what I do now is I'm sitting there going, oh,
Marky, we absolutely will talk about anxiety again.
Yeah.
Box breathing, yes.
Which bit's hardwired and which bit's not. So if you've got a particular behaviour that you're working
Grace,
on.
I so
relate. If it's hardwired and you put I know for myself, I would put so much effort into trying to apply particular approaches to fix something. And then I realised it's hardwired. I was never, ever going to be able to fix it.
Exactly.
Once I knew it was hardwired, I've been able to adapt, I've been able to modify. Suddenly a whole different kind of a heap of approaches come up with. So that's a big part of what I've found having a diagnosis.
Oh, unknown.
Really helped me understand my brain.
So, Grace, be honest with your clinician.
Yes.
Tell your clinician what you've been experiencing. Be honest. And I think that you'll get the result. And also, if I think you were the one who said 3 out of the 4 of your siblings have it, yeah, they're gonna look at you and go, welcome home. Just like I'm saying to you, welcome home to NeuroKind. Signs of PTSD, Domi?
So the big features of PTSD is the re-experiencing.
Kate, I'll write that down, and Marky will talk about anxiety.
Yeah, re-experiencing. So they're the flashbacks. That's where people will feel like they're back in the moment.
Marky, anxiety's next.
And nightmares. And then there's what we call hyperarousal. This is nervous system. So this is the autonomic nervous system, which is what runs the fight, flight, freeze, and it's the part of our nervous system that's there to keep us safe. In PTSD, because the brain's still sitting in a state of I'm not safe, as if the trauma is still happening, your nervous system will actually be sitting in that state of hyperarousal. So they're the really big 2 features of it.
This is just where it normally does this and just makes us prove that we're still on here.
And it's also telling us that we're probably getting close to the end.
Close to time. I feel like we've got some really good questions in here that I just want to answer.
Thank you to everyone who's
Can we do Marky anxiety again, just because she's left so many?
Okay. Look, there's a couple of different things. The first thing, and Hannah hates it when I talk about this, but it really is the core beginning thing, is that you need to see the anxiety for what it is. It's anxiety is actually an inherent, really important part of our survival.
Fight for your daughter
mechanism. Now, so it is not a disorder. It's not a disorder, the actual anxiety. It can become disordered. So that's the very first thing, is to kind of sit with, okay, there is a part of my brain, it's called the amygdala. It's just trying to keep me safe. One of the things about the amygdala I think is always really helpful to remember is that the amygdala is there to keep you safe, not to make you happy.
It's our lizard brain.
So it will go for safety. And
not a fan of it.
And then if you have a look in anxiety, it's a really uncomfortable state. So that's the other thing that I talk a lot to people about. Shifted across from I'm anxious. What that does is your amygdala hears it. It goes, we're anxious. Oh, I have to ramp up a bit more. And then
they've just added on to the question, is it normal that when someone mentions it and we start shaking and remember it like it's today?
Yes. That is very much a normal trauma.
That is a normal trauma response.
Yes. It's where it's in the system. There's a part of the brain called the hippocampus that holds it still as a active happening in the present experience.
You're so welcome, Rebecca. We're glad we could be here for you. Kez, if someone in your family doesn't want your daughter diagnosed, that's because they have prejudices against neurodiverse people.
Unless, depending on where you are in the world, we just want to be really clear. There are some areas in the world that are it's still very, very stigmatized, and it's not as easy for people. So that's important to take into consideration as
well. She's in Australia.
In Australia. God, no. We are really working to shift the stigma. Ask the family member what it is that they're fearful about or worried that might happen.
Yeah, why would it hurt to have them diagnosed?
It has changed so much.
Why would it be a bad thing?
Well, 5 years ago it was. 10 years ago it was.
Yeah.
So, this has actually shifted very, very quickly, and for, a lot of people might not be aware of how much it's shifted.
Marky, anxiety, please do the things that really help me.
Yeah.
Icing, get ice out of your fridge. Put it on your face, put it on your wrists, put it on your hair, have an ice cold bath, have a scalding hot shower, do things that immediately trigger your
the other one that can be helpful, and again,
and then can we also do H? How do we manage PDA?
Is when you're in an anxiety episode, start talking to yourself in that I'm uncomfortable right now. This is really uncomfortable. This is really
uncomfortable. Now, even though you're like, I'm going to call an ambulance because I'm going to die.
And I call it gratitude mindfulness, but really very much bring it back to this is a really uncomfortable state I'm in at the moment. That shifts your whole brain across from there's something we need to be worried about, there's something that we need to be fixing or keeping ourselves
That's right,
safe
Chris, EDMR.
Across to a much more compassionate, kind of supportive, how do we get through this? How do we deal with this uncomfortableness, particularly if there's spikes, because you know that there's a certain amount of time that it's going to take. It will feel forever when you are in an anxiety attack.
Thank you, Chris. God, you're a hero. Anybody who's in here now, please follow Chris. He's our moderator. He runs the show.
Yeah.
We don't know what's going on without him.
No, he's absolutely awesome.
He's amazing.
So we had a what to do to help pathological demand avoidance. There's some awesome resources out there right now. You reword. You shift it across. So whenever, instead of demand, having it as a demand, go and put your shoes on right now. You can word it in we're leaving for school in 5 minutes and you'll need to have your shoes on. It's a very simple kind of shift in language, but it doesn't trigger the brain the same way.
Yeah, so flipping the script, I find, helps a lot. Breaking whatever kind of pattern we're in.
Smaller amounts.
Yeah, breaking down things.
Yeah.
Can grief spike anxiety? Absolutely.
Yes.
Liv, you're jumping on right at the end, but we love you and we're so glad to see you. Everyone give Liv a follow. She's hilarious. She's amazing.
But the biggest thing about PDA is it's not a won't, it's a can't. And as soon as you shift that across, it decreases your distress about it, because it's not just they're not doing what I'm saying. It's very much, okay, their brain is stuck on this one. How do we approach it?
Yeah, so don't approach PDA as like, I know it's really hard, especially if you're dealing with a child and you're like, we need to get to school. But remember that it's not that they want to be difficult with you, it's that they can't.
Yeah.
And so our attitude is always approach with zero shame and compassion.
And look, one of the things with PDA that people often get very surprised about is it will play up to your own internal demands. So I have to go and brush my teeth right now. PDA will come up and go, no, you're not. And this is all happening internally.
Broken Angels asked this several times, but I'm not sure BPD versus BPD, are they different or just
can
a
I ask,
worsening
extreme
mental state?
BPD versus BPD, are they different or just worsening? Look, I'm assuming that they can be
Marky, I'm so sorry.
Yeah, it's very different with the personality disorders itself. They can shift across a very big spectrum of function and effect on
And you'll
people.
see across, like if you've got a cluster, so you've got cluster B, you might be seeing things that are pulling from all different areas. Like it's the brain is very, very complicated. How to deal with trauma anxiety from Olivia.
So one of the things we do when we're talking about trauma anxiety is check out, so we actually use different language for anxiety, which is where you've got a fear often about something that's about to happen, and then your amygdala is reacting to that. In trauma, we use the term hyperarousal because it's referring very much to you're going to have the experience within your body that you experience with anxiety, but it's actually where your autonomic nervous system is stuck in somewhere between fight and flight and freeze. And we do deal with them slightly differently, particularly in trauma. It's very much working with soothing and calming the nervous system and, seeing what we can do, whether it's top down, which is talking through to your nervous system, or bottom up using ice or physical grounding things or movement. So yes, very much about the nervous system.
Grounding, something I love. Putting my feet physically into the grass really, really helps. No worries, Chris. Mickey, how long can PTSD affect a person? That's interesting.
Look, it very long term. And I think that there'd be people who would know veterans from world wars who had ongoing PTSD symptoms all of their life. The big shift nowadays is we've got so much more understanding about it. We've got so much really good science about what's actually going on in the brain and the body, and we're getting more and more effective treatments.
And that's the thing, the brain has just been... It's the organ in the body that we know the least about.
But gosh, we've made some huge leaps over the last little while.
And God, we're just like in this phase where it's exploding. So it's very exciting to be talking about it now, dealing with it now, and connecting with other people that are neurodiverse. So, Kiko,
I'm just aware that we are probably going to have to wrap it up before I lose my voice.
We've got 3 minutes. Can you do 3 minutes?
Yeah, totally.
I got diagnosed with OCD and my psych did something where she waved her fingers around. What is that? I'm not familiar with that.
It definitely ask what it was that she was wanting to do. So one of the parts of EMDR, which is eye movement desensitization, is getting people's eyes to move while they're actually sitting with the trauma. Some people will use a computer program that's got a ball bouncing back and forth. Some people will use their fingers.
What a groovy little picture was that.
So it's but if you're having EMDR treatment, you really want to know that that's what's going on. It's a treatment that you need to explain and make sure the person's aware of.
And ask your doctors what they're doing.
Yeah.
Because remember that, you're their patient and you're entitled to know exactly what they're doing to you. I'm a big advocate for people advocating for themselves, saying, what are you doing? Why are we doing this? Why is this the advice? Tell me everything.
And look, sometimes when somebody's got a lot of anxiety and they're really hyper-aroused during an appointment, there's a lot of kind of like nervous system going on.
It's hard to get everything out.
It's hard to get everything out. It can also be hard to remember everything that gets said in a session. So sometimes the therapist will have talked about it and explained what it is, but if a person's really triggered at that time, they might not take in that information. A good therapist is always going to be really open to the questions and re-explaining things, and will understand absolutely that you're not going to remember everything that goes on.
If you don't like their vibe, see ya. I've ditched 2 male therapists.
Yes.
But that's because I don't want to see a man. Why do I want to go out of my house, pay to see a man? That's crazy talk. Sorry, I love men. Okay. I'm diagnosed BPD, ADHD, C-PTSD, very common comorbidities, zero shame. I find it so hard to do daily things when I have a bad day. Yeah.
And it's, so one of the big things in mental health is the lack of consistency. So, you've got some days...
I think we should do Altman as well before we jump off.
You've got some days where you've really got great function, and other days where right from the beginning. Compassion, awareness, that window of tolerance applies for this as well. Okay, where am I actually at right now? How much can I do today?
I allocate 0. I'm like, today is going to be a 0 day.
Yeah.
So if we can just keep basic hygiene, keep my son fed, healthy, then that's a win.
And sometimes give it a go, but give yourself permission that if you start, if you don't have the energy or the resources right now, that's okay.
If a child has 100 IQ on the WAIS, can they still pursue career in higher
so the
academia?
WAIS is a very specific neurocognitive tool that looks at a very specific cognitive measures and comes out with an IQ. The IQ, so 100 is very much that's the absolutely on the normal kind of curve. That's the, and but the thing is, it's a tool that doesn't take into consideration a whole heap of different aspects that are going to contribute to a person's capacities once actually in the workplace or in an academic kind of place. And they've also got a lot of cultural norms related to them. So, you know, that and prior education does affect them. So they can be very helpful in giving information and a bit of an indicator, but you're definitely not wanting to plan your long-term future or to judge a child based on them. They're going to be really tricky, and people with neurodivergence, often people with autism, will have scatter patterns so their overall IQ is not actually reflective of their capacities in certain cognitive domains that can be right off the chart.
Chris, I think we can say that SSRIs can be helpful with anxiety disorders.
Yes.
I think we're allowed to say that.
Yes.
We can't give personal medical advice, but I think we can say that.
And just I'll kind of, you know, I've gone back and forth with you know, using medication, because, you know, we don't want to just be throwing medication or only using medication. But if
Broken
a person
Angel, we're so glad you're
has
here.
got heightened enough anxiety, their brain is actually in a state at that point, it's very hard for them to apply psychological therapies. And there's a really very real reason in that time to use medication to get a person back into a state where their brain goes into a neuroplastic state and can start changing things. But it's also just that if you're really experiencing intense distress associated with mental health, we're wanting to manage that distress. The psychological treatments, all of the other treatments, they take time.
Perimenopause, cares. I want to do so. We have started a pod. We've filmed episode 1 of the pod. Episode 2 of the pod is going to be responding to the over 400 comments we got about negative things that neurodivergent people were told.
Yes.
I would love to chat about hormones and perimenopause on pod number 3.
Absolutely.
In fact, I'm going to write that down.
And it's just such an important area, because how much have women been dismissed in the past?
Medical misogyny.
Related to this area and the effect of the hormones, and particularly of those big shifts in hormones.
I'd love a pod episode about this. So first pod will hopefully we'll have it together in 2 weeks. We're just talking to the editor now. Then hopefully we'll be dropping a pod hopefully every 3 weeks. So pod number 2 will be answering all of these negative things that were said to neurodivergent children, which is horrible.
Yeah.
Like, I've read not all of them because I can't, but like it's just like trauma after trauma after trauma after trauma.
It's been really, really intense, and we are so grateful, and we really hope that sharing those comments and seeing other people's comments and seeing how common they were has really helped people kind of shift back. Hey, it's not just me, but it's also just, you know, notice how you feel when you see somebody else kind of, you know, labeling themselves in that negative way and you know, then applying it back. No, I wasn't too loud.
No, I wasn't too loud. No, I wasn't too sensitive. No, I wasn't too much.
The big one we're going to talk to got a lot, you know, they're bright but don't apply themselves. You know, why weren't they applying themselves? Did any of the adults actually stop and ask, what's going on for this kid? I was actually lucky enough to have adults that did, but a lot of people do not have that. Okay, how are we going?
So, Broken Angel, we will throw this in, Angie. That was me. I love you, Angie. Fibromyalgia, can mental health affect that?
Yes.
Now, yes, there's a
really big link between you know, mental health and then stress-related physiology. So that's and inflammation and the immune system. And then there's that crossover to when those other systems are dysregulated, and fibromyalgia is an example of one of those.
And there's a lot of study about that happening at the moment with things like POTS and
it's a really tricky one, because it's you know, one that people really struggle with to get heard and understood, and it's very painful and can be quite really, and I'm sorry, I'm just vaguing out a little bit right now.
Yeah, our brains are just shutting off.
The COVID nearly recovered, but
we're like
sorry,
I think we're like
not
at
due to lack of interest.
70 to 80% after COVID.
My brain is now going, yep, that's enough for today.
So we will jump off, but we will film a few TikToks during the week. I can't wait for you guys to hear the first pod because it is me interviewing Dr. Dom because her story is fascinating and there's so much about her you don't know that I think you will be fascinated as hell to know.
But we also are hoping it's a story that others will resonate with, and particularly the impact of late diagnosis.
If you got a late diagnosis, you're going to be like, what?
How things have been explained previously, but we'll let you okay. Let's finish up there. Thank you.
We love you all. Thank you so much to Chris. You're the most incredible mod in the world, and thank you so much for the support. Please follow us. Please share. Please jump on. We will see you here next Thursday.
Okay.
Love you guys. Later. Bye.